Live everywhere.
Daily Co's Radio on netrootsradio.com presents
David Waldman. Kagro in the Morning Show. Now, here's David Waldman.
Hey, good morning, everybody. It is Friday, and it's May 1st, 2020. Time for a brand new month. Are you ready for one? Have we got a month's worth of stories to share with you? Probably. Socked away somewhere. It's Friday, and we like to clean out the archives on Friday, but Friday is also the time when I grow weary at getting up early to make sure everything is in line for the show, and so my breakfast grows later and later as the week goes on. And without Greg on hand to break things up, it's tea sipping day, so we'll enjoy breakfast on the air and do the best we can. Daily Co's Radio is live now. There's nothing we can do about it. It's 9 o'clock and it's a weekday, so we turn to Bill in Portland, Maine. I think we haven't had a chance to read those tweets on the air for a little bit. Well, here's what's happening today. Kagro X, me, David Waldman, reassures America. Oh, shoot. All right. That's it. Reassures America that what happens in your home with a maypole during the lockdown stays in your home with a maypole during the lockdown. And it stays here all the way until June. At least that's the case if you are Japanese, which most of us, I think, are not. But Japan, it turns out, I see this morning, along with a illustrative photograph, thanks to The Hill, which has a fantastic social media operation if they're not actually all that good at regular media. Japan to extend coronavirus state of emergency into June. I still have to check into what we're doing here in Virginia. Early on, I understood that we were extending the stay-at-home orders until June 10th. Although now I'm getting the feeling that that might have changed somewhere along the line, but I'm not really sure. I plan to stay home. I'm having a great time. Everybody should stay home. And the right wing has taught me a lot about the shutdown. I think it's fantastic and we should keep going. I learned from the right wing that the deaths don't matter, so this is fine. And I also learned from them that the economy is haircuts. That's one thing. And from the stock market, I learned that 30 million people out of work and 60,000 people dying in the last couple of weeks also doesn't make a dent, and the economy is fine. So I don't know what everyone's complaining about. I think it's great, and I hope things continue, I guess. I don't know. I felt guilty about all those people dying for a little while, but then I was convinced by right-wing pundits that it's all okay, and they were all on their last legs, and they were going to die anyway, and COVID-19 doesn't actually kill you. It just accompanies you on your way to death. So it's all good, and you just have to think about things the right way is all. What is going on with Japan? How would the hell know? I don't know. Well, they're reporting somebody else's work, I'm sure. Let's go find out whose, and perhaps, there we go, the Associated Press. Yeah, but they don't have as nearly an interesting picture. Oh, they do have a nice picture. They have a picture of a Japanese woman in a mask talking to a robot, and the robot, you know how they have a lot of those robot sort of things. Friendly looking, what do they call them? A humanoid, well, it says here, humanoid robot, but, okay, or cyborg or something like that. I don't know what the actual name is for all of that. Anyway, let's see. We have, she's talking to one of these humanoid robots. The robot is wearing a mask as well to make everybody feel comfortable with their mask wearing. It's very interesting looking, but I don't know what it tells us about anything. The news is here. Let's see. The robot staff debuted at a Tokyo hotel for mild coronavirus patients under a plan to free up beds at overburdened hospitals. So I guess in Japan they've actually endured the the actual overburdening of their hospitals. We've had a very near overwhelming of the hospitals, at least in major East Coast cities, as I understand it. But they managed to tamp things down and keep them under control. And instead, it is the mortuaries and funeral homes that are overwhelmed and can't handle the things because they have dead bodies stacking up. Anyway, in Tokyo, they have such amenities as a hotel for mild coronavirus patients. That would be the isolation program that a lot of the Asian countries were able to adopt. And we never went to that. We just said, stay home if you're sick. And if you give it to your family members, do your best. But they've got a hotel for mild coronavirus patients. And how do you avoid making the hotel staff sick? You send robots, I guess. This is Pepper, a popular semi-humanoid talking robot, greeted Tokyo Governor Yuriko Koike as that's who this. I'm like a Japanese woman. It's the Tokyo Governor, I guess. Although it doesn't say so. There we are. If you scroll over the picture, then you get a caption that tells you she's not dressed in gubernatorial uniform, I don't think, although she's got kind of a name tag on and a patch on her shoulder, but she's in what looks to be a denim jacket and casual clothing, so I mistook her for an ordinary Japanese person speaking to a robot, when it is in fact the governor. I don't know what the governor of Tokyo does. I guess that's a province as well as the city. Well, Yuriko Koike was there to talk to Pepper, and she walked into a downtown hotel during Friday's demonstration. Now, I don't think that they mean an anti-government demonstration like we're having. They mean, I think, a demonstration of the new robot staff, but I'm not sure. Pepper, wearing a white surgical mask, hard to see against her white plastic skin, also reminds patients to check their daily temperature, if that means anything, and encourages them to rest. Doctors and nurses are staffed at the hotels. That's good news. So if you actually get more ill beyond mild coronavirus symptoms, you can call them. Guest patients can also access health management applications on computers and tablets to record their body temperatures and symptoms. Whiz, a cleaner robot, that is to say, a robot, I guess, that runs around cleaning things. Not that Pepper is disgusting, but Whiz is less so. Is it cleaner than Pepper, anyway? Whiz, that's not really a good cleaner name. But, English is not necessary. That's us, not them. I don't know. Maybe it makes sense in Japanese. Whiz operates in hotel lobbies where patients come in to pick up meals to reduce infection risks. Well, there's a lot to that. And a lot of words doing a lot of work in that. But I think you get all the implications of that. Anyway, the robots made by SoftBank Robotics. Not just anything. SoftBank Robotics. Isn't SoftBank like one of the ventures that Jared Kushner is somehow tied up in? I don't know whether they are also SoftBank Robotics or what. Well, anyway, the robots will be deployed at other hotels rented by Tokyo's government for patients with no or mild symptoms. So there's even a place for asymptomatic positives to go, if you're Japanese. So far, Tokyo has secured 5 hotels with 1,500 to 2,800 rooms. Japan has 14,281 confirmed cases and 432 deaths, according to the Health Ministry tally. And as you know, they're a fairly densely populated nation, Tokyo in particular, a densely populated part of that country, and they managed to keep things pretty well under control by having an active program of monitoring health effects, testing people, and quarantining the positives even if they are asymptomatic, whereas we have gone with the approach of, if you would like to bowl, you should go ahead and do so. And if you would like to run around in your state capitol building with a gun, you're welcome to do that as well. Yesterday's images from Michigan were rather startling. We've seen it before, of course. Every so often, the AR-15 crowd gets together to assert their right to carry their AR-15s into capitol buildings for no particular reason. Yesterday's reason was everyone wanted to dress up and wear their body armor, helmets, gas masks in some cases, and the vests that go along with the body armor, that hold the body armor, now also in military cosplay style, are festooned with extra magazines for the rifles, those oddly shaped military flashlights that you can stick in a pocket and have the light shine, the bend at 90 degrees, so that you could have the light shining ahead of you even while it's in your vest pocket, and who knows what else, and lots of patches from unofficial made-up units that don't actually exist or that are part of a militia or what have you. and they march around to show their displeasure with overreaction. That struck me yesterday, that they were out there to protest governments overreacting and overdoing things with their lockdown orders. And so they needed to, of course, A, demonstrate, and B, anytime you gather a large crowd or a crowd that aspires to be large but is actually just a few dozen people in some cases, you're going to need security. And the best way to provide security from nobody, since the rest of the country is locked into their houses, the best security you can possibly provide for 10, 12 people hanging around on the lawn of an abandoned government building is everyone carrying an AR-15, because that's totally not overdoing it. Well, okay, I mean, that's the way they chose to spend their time, but it looks like it's going to work. They're pressuring people into loosening restrictions all over the place, some of which may be undertaken reasonably, as is, I think, the case in what I heard described anyway in the Bay Area, minus the flea market thing that we discussed yesterday. Some activities that might become acceptable, at which it's easy to imagine people maintaining proper social distancing. And in other places, of course, massage therapists, as they're calling them these days, and body art studios, as they call the tattoo parlors these days. And, also hair salons and presumably barbershops. The manly men among the protesters, of course, will have nothing to do with hair salons. They're going to go to barbershops where manly men go to have their heads shaved, which is actually something you can do at home. I did notice yesterday that a lot of the protesters inside the Michigan Capitol building, who I guess were joining the protest because everybody needs a haircut, very decidedly were not in need of haircuts. Although, perhaps some facial hair grooming might have been in order, the haircut wasn't necessary. But yesterday's situation in Michigan, I didn't save any stories on it because the whole story itself is ludicrous, but apparently the situation there was they gathered for, another one of their protests, and it began to rain. And they had some cover set up for the speakers on this, makeshift stage that they had. Well, one of them wasn't even so makeshift. And some canopies available for some of the protesters, but rain came, and these are survivalists, so they had to go inside during the rain because, well, the way to survive really is to go in, have enough sense to come in out of the rain. But they hadn't prepared for outdoor endurance in the rain. So into the Michigan Capitol building they went, and that sort of sparked their interest. Now that we're inside and we're a large group and some of us have guns, why don't we demand to be led onto the floor of the legislature and push the legislators around and make them vote the way we want by pushing them, shoving them, yelling at them, and having a lot of guns, so that the police, who are ostensibly there to protect the legislators, really can't do anything. And that's another of the takeaways, really, from the situation. I thought it was an interesting juxtaposition, watching the protesters literally screaming, maskless, of course, screaming in the face, right in the face, of the police lining up in front of the doors to the chamber of the legislature, which was in session, as it turns out, and screaming in their faces about and the crowd chanting, "Let us in, let us in." They did eventually let even the rifle carriers into the gallery up above the floor of the legislature, which some of the legislators discussed on Twitter and found rather disconcerting. Though they were trying their best to do the tightrope walk on guns by saying they weren't necessarily intimidated by the guns, you see. But what was really bothering them was all the unmasked people screaming at them down on the floor from the gallery up above and raining their germs down on all of the legislators below. So we'll see how that affects health in about, 15 days or so, and see where we're going with that. It's been, I guess, 15 plus days since the beginning of this protest thing, which they like to call a movement. So we should be seeing some of those illnesses catching fire shortly. I happened to see Josh Marshall on Twitter this morning sharing a graphic that he generated using the COVID-19 tracker site's data. That let's see, let me see if I can bring that up. He charted in a bar graph fatalities from COVID-19 in New York State, and then the rest of the country minus New York State against one another. And so you can see this at one point, of course, New York State, really all along, New York State represents the, if not the majority, then certainly the bulk of the deaths nationally. But what's more interesting is that you can see an interesting shape to the curve of the number of deaths per day in New York. And you can also see that that number has peaked and is on its way down. I guess I would say the flattened look of the bell, still bell-ish shaped curve here, suggests a very shallow approach to the front end of the bell and then a rather steep ascent. It is flatter than the charts that we were worried about seeing, but a relatively steep ascent up to the peak. Then an indication that they were going to drop, and but then a little second spike, but no higher really than the original peak, and then a long slope down. It's not the same sort of steep drop off and then long tail as you see on the front end of the curve, and I think that's to be expected. We're not going to get a even distribution, or what they would call, say, the normal distribution, but it may be even in terms of the numbers. But it actually looks like the tail end will probably contain more area under the curve because of the shallower downward slope on the other side. Meanwhile, the curve that you would generate to show the, going from the peak points or maybe even the average number points per day on the national chart behind it, superimposed on it, doesn't yet indicate downward sloping activity. It's not rising up on the steep upslope yet. It looks like it too may be reaching a peak and getting ready to slide back down. But it is, let's see, according to the chart, looks to me like right about right around April 15th or 16th or so is where I would peg what we hope is the final downward slide of deaths per day in New York. Whereas if this chart correctly, if we're reading it correctly, because the data ends yesterday at 4:30, that is to say April 30th, not at 4:30 in the afternoon. But so we can't tell whether it's going down yet. It looks like it might be at a peak, but that's, 15 days, half a month after New York. So New York still experiencing fairly high and disconcertingly high numbers of deaths even at this date. And so 4:30 looks to be at about half the rate of what it was at 4:15. So if this national chart follows the same pattern, which it shouldn't, because of course the conditions are different inside New York as from what they are nationally, and with the loosening of restrictions. I mean, New York stayed locked down during the period from 4:15 to 4:30, and the rest of the country actually not so much. For the most part, still did. The loons were out, but then there's of course a number of states that have refused to impose any serious restrictions, and then some that have just looser restrictions than New York ever did. So I guess at best, if the rest of the country does mirror New York's results, in about 15 days, somewhere around May 15, we might see the daily reports of numbers of deaths down to about half of where it is now. Now, you should keep in mind, of course, if you're also tracking things in terms of the raw numbers, as we have, and been interested in watching when were we going to hit that 60,000 death mark. And I would advise you, by the way, according to the Worldometers, I would guess we're about an hour away when people start waking up and making their reports. About an hour from now, we would expect to hit about 64,000 reported deaths on Worldometer, and we'll probably end the day somewhere around 66, possibly 67,000, which means hitting 70,000 over the weekend instead of, again, in August, as we were supposed to when Trump pushed the goalposts back over the last couple of days as 60,000 approached. Anyway, we're still posting nationally numbers in excess of 2,000 dead each day, down slightly from an average closer to 2,500, but we'll see how that goes. Of course, the weekend will slow things down, and they'll slow down the reporting into Monday as well, and it'll look like we're sloping off, and then we'll spike back up again. That's another of the features of Josh Marshall's graph. Lots of people asking, what is all this wild fluctuation, these little spikes in the national numbers? And the national numbers is what we've been talking about on here, weekend reporting backing off. Anyway, so what that means is if we're reporting about 2 to 2,500 dead daily on a national level, I guess if we can mirror the New York numbers and the New York pattern, by May 15th or so, we'll only be having 1,000 people a day dying from COVID-19. Better than 2,500 to be sure, but if we're racking them up at 1,000 a day, and we're hitting 70,000 this weekend, well, then there's really no chance at keeping the numbers down to what Trump was talking about. I mean, it would require a magical disappearance of all the cases in the pipeline, and all of them would have to resolve favorably in order to save us from eventually flirting with the 100,000 death mark, I would assume. And if any of the other localities experience, outside of New York, experience any sort of a spike, then you're really going to lose control of those numbers. And if it starts climbing back up to the 2,000 mark, come June, we're going to be looking at numbers, at the very least, well above what the president said was going to mark a good job. 100,000 or less was supposed to be a good job, according to Trump a couple of weeks ago. But, time passes, and he will try his best to convince you that he never said any of those things. And there will be some people who believe it and some who don't. I will say that I also read some articles that were somewhat interesting. I might share one of them with you that take a counter perspective, or offer up a counter perspective on the opening up of America, or at least maybe New York. It was offered up. Well, the original piece, it's in the New York Post, which is not always the greatest place to turn for this sort of information. Though it was written by a guy who says he is an emergency department doctor in St. Barnabas Hospital in the Bronx. And I think it was offered up, on its face, it's really just about what his experience has been in New York and what he thinks about the lockdown and what we ought to be doing next, I guess really in his area in New York. It was carried forward by people who think it might be broadly applicable worldwide or nationwide, and I'm not certain that it is, and I'm not certain that the doctor is arguing that it should be, but I thought I might share this with you. It might be some glimmer of hope for, loosening things up in the near future and doing things, and having reason to believe that it won't be terribly dangerous if done correctly and in the right places. It's an opinion piece, as I said, New York Post, dated from the 27th. Daniel G. Murphy is the author, and the title is, "I've worked the coronavirus front line, and I say it's time to start opening up." And it says it this way: "I'm an emergency physician at St. Barnabas Hospital in the Bronx. I've been in the ER every day these last few weeks, either supervising or providing direct care. I contracted a COVID-19 infection very early in the outbreak, as did two of my daughters, thanks to you, probably, but okay, one of whom is a nurse. We are all well, thank God. COVID-19 has been the worst healthcare disaster of my 30-year career," so don't mistake him, right? "Because of its intensity, duration, and potential for lasting impact. The lasting impact is what worries me the most, and it's why I now believe we should end the lockdown and rapidly get back to work." From mid-March through mid-April, the ER staff at St. Barnabas huddled in groups of about 20 every morning. We asked ourselves what had happened over the previous shift. We generated a list of actionable tasks for the following 24 hours. At first, we addressed personal protective equipment and the management of patients with mild illness who were seeking COVID-19 tests. Then came the wave of critically ill patients in numbers none of us had ever seen. This lasted for 2 weeks. The number of patients on ventilators accumulated in the ER and throughout the hospital. We witnessed an unprecedented number of deaths. The tone of the huddles became more somber. We became accustomed to the morbidity. We did our jobs. It is precisely what I have witnessed that now tells me that it's time to ease the lockdown. Here's why. Well, that's counterintuitive, it would sound, right? Well, why don't we save the here's why for after our first 2-minute break. I know, the break comes at an inconvenient time. But we'll parse through it and see what he has to say. Like I said, I'll preview this part of it for you. I think it is perhaps only meant to be uniquely applicable to exactly where he is and exactly the city he's in, but later might be applicable to the rest of us. Hi everybody, it's me, David. Let's change things up from the old fundraising pitch for just a minute and talk instead about how you can be a part of our show. If you've got a smartphone or any other electronic recording device, why not sit down and record a segment for us? Read us an important article and give us your take. Read one of your own original essays, or even just give us your commentary on something you'd like to share that's important to you. Then send the file to me at kagrox@gmail.com, and I'll try and work it into the show. Short segments, a few minutes in length, are easiest to fit in. And of course, I can't always guarantee that I'll be able to play everything, but if you've ever shouted at your radio or TV about something you wish was being covered, here's your chance to change that. Make the show your own. Send your submissions to me at kagrox@gmail.com. Welcome back now to the Kagro in the Morning Show here on Netroots Radio. Are you ready to find out what this doctor has to say? Why would we end or ease the lockdown? By the way, some of this stuff is linked. What is he linking to when he says ease the lockdown? Coronavirus tests must double before lockdowns are lifted, says Fauci. That's the article he's linking to. What's interesting that he leaves that out. It's time to ease the lockdown. Does that? I don't know whether linking that, whether it was his idea, and if so, is he disputing Fauci's pronouncement that testing should double along with, or in order to implement an easing of the lockdown, or whether he's denying that any more testing is necessary? It's unclear. But certainly the right-wingers using this article seem certain that the testing is unnecessary based on, like we were discussing with Greg yesterday, based on the fact that 1 out of 1 people in their basement agree that the lockdown can end without additional testing. But this guy's a doctor, so we're not sure exactly what he's saying. There's also a link here. His link on the words when he was talking about this being the worst healthcare disaster of his 30-year career because of its intensity. And, its intensity, I guess, linking to the story of a Manhattan ER doc who committed suicide because of the intensity of the work, apparently being overwhelmed by the emotions of having to care for so many dying people day after day and with what looked like no end. That is a real tragic story. But by the way, when it was mentioned, I did note that it was Donald Trump told us that all the suicides were going to be the people so depressed about having to stay home for such a long time, and they've seen everything on Netflix, and now they have to kill themselves, which was an odd way, but he's a very terrible person, but an odd way of belittling the more grim reality of the people who were doing the work of digging us out from underneath this pandemic, who would be committing suicide because they could never just simply go home and hang out. So anyway, whatever. Not that everybody who's locked up in their homes are hanging out and happy to be there like I am. I get lucky on that one. All right. Well, what does the doctor have to say about why it's time to ease the lockdown? First, he says the wave has crested, and he has very specific metrics on this in his mind. At 1 p.m., April 7th, maybe they keep notes. I mean, they certainly have records in the hospital. You can go and look. At 1 p.m., April 7th, the COVID-19 arrivals slowed down. Okay, it was a discrete, noticeable event. Stretchers became available by 5 p.m., and the number of arriving COVID-19 patients dropped below the number discharged, transferred, or deceased. Deceased being the key issue there. This was striking because the community I serve is poor. Some are homeless. Most work in essential, that's in scare quotes, low-paying jobs where distancing isn't easy. Nevertheless, the wave passed over us, peaked, and subsided. The way this transpired tells me the ebb and flow had more to do, he says, with the natural course of the outbreak than it did with the lockdown. Now, I'm not certain what drives him to say that, though it could certainly be the case. He pins it at April 7th. It looks to me like the numbers for New York State, anyway, put it at closer to April 15th. Although, again, I'm going to take a look at the numbers I saw for, or the chart that I saw from Josh Marshall, because I was describing to you that, where did I put this thing? That there was this dip and then second peak, but it actually happens more than once in the New York State numbers. There's what looks like a peak, and then maybe we're on the downslope, hits around, a peak around April 4th, and then April 5th and 6th look like they're either plateauing or perhaps maybe on the way down. But then right about April 7th, where this doctor says we began to see fewer people at St. Barnabas in the Bronx, April 7th is right about where the first false peak reverses itself and then peaks again somewhere, just slightly higher than that first peak, somewhere around April 9th or 10th. Then it sort of plateaus, and then it takes a dip around April 13th, and so everybody might have thought, that's finally it. And then up again, just so that we're getting just again beyond the number on the chart of about 750 deaths a day for New York State around April 14th and 15th, when people started protesting in other states that they'd had enough and they all wanted to go bowling. So there's a mini peak around the 4th or 5th of April, and then a more prolonged peak that actually looks like it's the highest of the peaks around April 9th, 10th, and then another mini peak that brings us back to the same neighborhood around the 14th or rather the 15th and 16th, and then a downward slope, and then a little bump, but not enough to call it another peak, but it's clearly on its way down. It looks like it's been a more or less a constant descent from around the 16th, whereas nationally it was still very clearly on upswing at about that point. Okay, well, I just wanted to point that out. So right around where this doctor says there was a noticeable break with the number of people coming in, does coincide with the first dip in New York State, but then there's an increase. Now, those increases may just not have occurred at St. Barnabas, but rather elsewhere. And it may or may not lend some credence to his theory about it not being so much about lockdown that kept those numbers down and sent them plummeting. Well, not exactly plummeting, but dropping at that point, but rather the natural course of the disease. It may be that in the area around St. Barnabas in the Bronx, where so many people were stuck in those so-called essential low-paying jobs where distancing isn't easy, were just, they had wiped themselves out. They'd all passed around the disease, and it had saturated the population faster in the Bronx than it did in, pick your other borough or the rest of the state of New York for that matter. And they were on their way down there just about a week before the rest of the state began to drop. That could certainly be the case. So anyway, it's his supposition that the ebb and flow had more to do with the natural course of the outbreak than it did with the lockdown. And then he moves on to the second point. So we could use some more elaboration there. Second, I worry about non-coronavirus care. This is also now a big right-wing talking point as well. When and there's some possibility that there's a germ of truth to it. While the inpatient units remain busy with sick COVID-19 patients, our ER has been quiet for more than a week. We usually average 240 patients a day. For the last week, we've averaged fewer than 100. That means our patients in this diverse, low-income community are, he says, afraid to come to the ER for non-COVID care. That could certainly be the case. And of course, for a long time, people were really, almost overtly warned off of seeking care, certainly at the emergency room, if they sought care for almost anything other than COVID or actual emergency care, like my leg got chopped off or something like that. Whereas, we're always discouraging people to go there for their routine care or, where they could be seeing a primary care physician if they had one or they had access to insurance, which in many cases they likely did not. And so that's why they resort to the emergency room. And I'm sure that there are a lot of people who would otherwise have gone who said, to hell with it, I'll never get some care anyway. They're so busy with COVID-19. Plus, I'll end up getting COVID-19 if I go. That's certainly possibly true. Of course, with New York City and the state and so many of us around the country on lockdown, there's also the distinct possibility that cutting your emergency room admissions in half once the wave of coronavirus patients began to subside could have a lot more to do with fewer people out there interacting and doing the things that they do that lead them to the emergency room, running one another over with cars, accidentally shooting one another, cutting their fingers off while slicing bagels, contracting mumps or thinking you did, what have you, or just needing some sort of medical care for which you're not insured, so you go to the emergency room where they can't turn you away. That could have explained a lot of it, but he says it was because everyone was afraid to come to the ER for non-COVID care, as opposed to not needing any because they had spent the week in their house. Gotham-wide, the number of 911 ambulance runs declined to 3,320 on April 18th, which is, of course, 11 days after he said the peak came and went. But on April 18th, they were down to 3,320 911 ambulance calls, down from a peak of 6,527 on March 30th, according to the New York Fire Department. The current nadir is significantly below the average. A large share of those staying home surely have emergency medical and surgical conditions not related to the novel coronavirus. The growing numbers dying at home, and the excess deaths situation we've been talking about for quite a while now, the numbers dying at home during this crisis must include, but wouldn't necessarily all be, but must include fatal myocardial infarctions, asthma exacerbations, bacterial infections, and strokes. Meanwhile, our pediatric volume, what he's saying here is lots of people will die of lots of things, but many of them who might otherwise have said, I got to get myself to the emergency room or have someone take me there, might have said, no, I am hesitant to do so. Or if they could have intervened at an earlier stage, when it wasn't obviously an emergency that was immediately going to kill them. Well, no, I don't want to go to the emergency room. Things are terrible there. Let's stay home and suffer with whatever heart condition or bacterial infection we might have. Of course, on the other hand, a lot of these heart conditions may have been exacerbated by COVID-19, or same for the strokes, of course, as we've been hearing a lot about that issue as well. But he glosses over that. Meanwhile, our pediatric volume in the ER has practically disappeared. Visits to primary care pediatricians are also down, with vaccine schedules falling behind. Everyone seems to be avoiding the health system, an important and unfortunate consequence of the stay-at-home strategy. Third, inordinate fear misguides the public response. While COVID-19 is serious, fear of it is being over-amplified. The public needs to understand that the vast majority of infected people do quite well. Well, versus death, of course, is what he's talking about. I also understand that a fair number of people who, after the fact, will say, well, versus death, I did quite well, are also very forthcoming in saying, it's hellish, and I was sick in bed for 3 weeks and thought every moment about the possibility that my lungs would just fill up and I would die and that would be it. Though there are others who say, I was sick mildly for 3 days and I really didn't think I had coronavirus, and I was one of the people who would have been overreacting to go and get a test, but as it turns out, I ended up finally, getting a test, and I did have coronavirus. Whoops. Well, for some, we already know that there are some people who are asymptomatic. They, of course, will tell you, it ain't nothing. Anyway, this is the more interesting part of it here, I think. He says, finally, and it's not just interesting because he's almost done, COVID-19 is more prevalent than we think. I don't know. We think it was pretty prevalent, but I think he thinks most people think it's not for some reason. Many New Yorkers already have the COVID-19 infection, whether they are aware of it or not. As of today, that would have been on the 27th, over 43% of those tested are positive in the Bronx, where his hospital is. We are developing a significant degree of natural herd immunity. Another invocation of herd immunity theory here. Distancing works, but I am skeptical that it is playing as predominant a role as many think. It is entirely possible, of course, the living conditions and demographics in the Bronx that they've been overwhelmed by it. And that the testing they're seeing is indicative of conditions in the entire community, and that 43 or so percent of those living in the Bronx in general may have been exposed and have the coronavirus present in their systems. That's possible. And that therefore, the reason 43% of the Bronx isn't in the hospital is that a significant portion of the population experiences it without symptoms so far, and others experience it with mild enough symptoms that they can stay home and away from the hospital. But 43% positivity, I don't think meets the criterion that, as far as I understand it, that doctors have been discussing when they talk about real herd immunity. I've seen a couple of numbers thrown around that you got to be, a majority of the populace has got to have been exposed in order for there to be herd immunity. I think that's probably just a general principle that would apply. But I usually see the numbers like 60%, or in some cases, some particularly virulent diseases, 80% of the population has to have been exposed or immunized in some fashion in order for there to be wider herd immunity. 43%, by most definitions that I've seen, wouldn't do it, which is, I think, why he was expressing it as developing a significant degree of natural herd immunity, like halfway there or 3/4 of the way there. I'm not sure how he would clarify it if we could put the question to him, but 43% is pretty significant. And I would imagine it's much lower outside of the Bronx and lower still outside of New York. And this is what worries us about some of the premature reopenings around the country, that they haven't seen infection rates that high, and that they soon will, and will soon begin to see in places that don't have as many ICU beds or ventilators as New York City does. Many more people who find out that they're not among the asymptomatic crowd and have to head to rural hospitals where they have 2 ventilators, and we'll begin to see a spike in those deaths that'll keep the nationwide numbers spiking higher and higher as this wave moves across the country. Anyway, he continues on here, saying more testing will better establish the numbers among those with mild illness and no symptoms. My professional experience tells me the number of infected people will be high. Well, okay, me too. I'm not a professional. Testing is important work, but it should happen in parallel to the immediate resuscitation of the economy and getting people back to work. At present, the testing is imperfect. We can't wait months. We must protect the vulnerable and mitigate without destroying the economy. I don't know whether that's really... if the economists shouldn't really be doing the epidemiology, I guess we could also say maybe the doctors shouldn't be doing the economics, but you never know. Standing up to this virus can't be the job of essential workers only. We've been strong, but we're tired, and we need the rest of you to help us by getting back to work, which is interesting, and it's an interesting thought, but I don't know if the conclusion necessarily follows. You're tired because you're an essential worker, and you're an essential worker because you're a healthcare worker. That's all understood. I guess what's puzzling is how does the bowling alley guy getting back to work help the healthcare worker get much needed rest if it ends up being that all the people who go bowling go to the hospital? Or if not all of them, say 57% of them are in danger of needing their help, whether as inpatients or not. I don't know. So, yeah, aspects of stories like this are being seized on all over the place and in basements across America. And I'm not certain how much to take away from it, except to say I do believe that it's possible that in places that were stricken very heavily and very rapidly and the disease really washed through very quickly, it may be possible that a significant portion of the population has in fact been exposed, and we're getting a fairly clear sense of how many people are really going to exhibit enough symptoms to make it to hospitalization at this point. But outside of New York, and perhaps California, I'm not certain that we've reached that point around the country. And I guess if 43% of the population of the Bronx has become exposed, just makes me think it's time to take out the calculator here. And if that turns out to be, let's say, 1, that it's correct, 2, that it's generally applicable everywhere, eventually, after 3 intense weeks of COVID infections in your area, 43% of your neighbors will also be positive for coronavirus, and the numbers will never get higher, and that somehow does establish herd immunity or some sort of saturation point that's just not going to spread to more people for whatever reason, or at least not in any serious way. Maybe the rest of us are asymptomatic. Although this talks about positivity, not asymptomaticity. But if 43% of the general population were to get it, we're 328.2 million people in this country. And 43% of us would mean 141,126,000 infections, which is a lot. Currently a lot more than we have now. We've identified just over 1 million. And I do think we'll hit 1.1 million at some point later today. So it's interesting that we hit that milestone, and then we're going to be 10% past it in about 2 days. With 141 million, that means we're still waiting on finding out about 140 million of us having coronavirus. And if we were like the crew of the Theodore Roosevelt, all of us young and healthy and well-trained, then we could expect to see something, well, I think the number dropped down from 60 to about 50% asymptomaticity. So let's see, if we divide that number by 2, let's say, we'll have 70 million asymptomatic carriers out there, and 70 million or so, 70.5 million on either side, who develop symptoms. And I think they were saying that about, 10% or even 5% ended up needing hospitalization. So let's see, if we go by 5% at that point, well, that gets us back to our original scenario that everyone was worrying about when we were supposed to be flattening the curve. 3.5 million hospital admissions at 5%, and we don't have anywhere near that kind of space. Well, let's see. What if we back off of that number again and say 1% need hospitalization? 705,630. And if well, I guess I don't know what the mortality rate among those who require hospitalization was. But I guess that's been running pretty high too, because what I'll call the apparent mortality rate, which is the only numbers we've got, the numbers of people who have died and the number of people who have been tested as being, registered as positive test results. We're nearing, at this point, it's crept up above 5.8%, nearing 5.9% at this point. But even if we said, if we just did 5%, we'd be talking about 70 million infections, and 5% of them, if they were dying, like the numbers that we actually have in hand have showed us, then we'd be talking about the 3 million deaths figure that we were just using as our hospitalization number. So the argument is also put forward in this and other articles that, once we find out how many people really actually have been exposed to this and actually have coronavirus versus the number who actually die from it, when we have the totality of the picture, we'll find out that the mortality rate is considerably lower than 5%. And the right-wing-ish naysayers still say considerably below 1%. One of these articles was holding out 0.25% as a possibility. But then again, if we had 141 million infections to deal with out there, 0.25% would be 0.0025. 352,500 is the figure. So, if it's generally applicable that 43% of the population will test positive, and of that 43%, 0.25% will die, well, that's about 300,000 more people than the 60,000 figure that they were pegging it to the other day. And things are really going to get out of hand. And that's if we just give it to everybody all at once, and it doesn't roll wave after wave back and forth across the country as we open, close, find out there's a mistake, reclose, reopen, open to bowling alleys, and let's say mud wrestling, because people need to have that. There's a lot of mistakes that we could still be making, I guess. But I do hold out, I opened it up for the contrarian view here. I was intrigued by some of the hints that he was giving about maybe at some point, if despite your best efforts at trying to contain things by having everybody stay at home, he does acknowledge that did make a dent, but, we still, I guess, have to wait for finding out how this thing is going to react in less densely populated areas if we simply let everybody go on about their business and get back to work, as they say. Speaking of the getting back to work thing, another interesting note about that, I did see somebody circulating this story here today. How can I open this one up? What are we looking at? A thread by someone I don't know, I don't think, on Twitter known as The Defector. And this picture here is what? It says, Joey Gibson just made a feel-good short video about defying the lockdown. He had a child hold this sign during a part of this video. Where have you heard this before? Now, there's a watermark down in the corner of the video still that's displayed here. It says nonessentialhelp.com. And I don't know, this is one of those we all need to get back to work kind of things. We all need to be free. We all need to enjoy our liberties as Americans and get back to work, which doesn't sound very free at all. But anyway, the kid has been handed a sign to hold here for the video, and it's a little troubling. It reads, "Work is freedom," which it really just doesn't feel like the case anyway. But it also has a problem because, as people pointed out, hey, how would you translate work as freedom? Obviously, like, the whole world has been suffering from coronavirus and the outbreak. They've been doing particularly well with it in some countries and particularly poorly with it in others. And perhaps you might think one of the countries, as it happens, where they've done considerably better than us is in Germany. And that might lead you perhaps to ask, hey, how would you register such a sentiment in German? Work is freedom. And, well, everything falls apart from there, of course. I have a feeling that you know already. They're talking about the slogan displayed over the gates to the Auschwitz death camp in Nazi Germany, Arbeit, is that how they would say it? Macht frei. I think I have the pronunciation correct. Maybe, maybe not. Work will set you free. Work will make you free. Work is freedom. Yeah, well, it was a work camp, supposedly. First, of course, they worked you to death there. But anyway, it's just sort of one of the warning signs that you've gone in the wrong direction if you find yourself holding that up as a slogan, particularly in a situation where a lot of people are dying. You might want to check it against history. Anyway, we'll be right back. All right, welcome back now to the Kagro in the Morning Show here on Netroots Radio. Just checking in on that work is freedom situation. It's a little baffling how you could miss that unless it was intentional. There's also a possibility as well. All right, let's see. Plenty of other stories. Maybe we ought to change directions from here and get back to just reading you things that are more factually based and reported more thoroughly than my own musings about one ER doc's thoughts about what happened at 1 p.m. on April 7th at St. Barnabas Hospital. Let's see. One probably interesting thing we ought to talk about if we're thinking about reopening parts of the country or the entirety of the country, probably getting the data and having it be accurate would be important. Reports out of Florida that Governor Ron DeSantis has defected and joined the Communist Party of China, apparently. I wasn't expecting that, but you may recall that over the past couple of days, another right-wing hobby horse has been blamed China because China has been suppressing the real truth about the numbers of deaths from coronavirus in China and elsewhere in order to make Donald Trump look bad, as he honestly and thoroughly reports the coronavirus deaths here in the United States and simply faces the music for it because America is a free country. Whereas in China, you can manipulate the news, come up with fake news, and make yourselves look really, really good. Although, again, I'm not 100% sure where these theorists think China's doing great. I'm not certain what part of the world everybody's like, you know who's really good about viruses? China. They've done a fantastic job. Certainly there are people who point to their death tolls and say, well, it's lower than ours. But I don't think anybody actually believes that everything's been awesome out of China. But I don't think we can drive that narrative if Florida, as it turns out, is suppressing their numbers too. And I think everybody, once we found out who was getting hit particularly hard by coronavirus, once we learned about the vulnerability of the elderly I think everybody's thoughts kind of immediately, at least here on the East Coast, turned to Florida. Maybe on the West Coast they thought about Arizona. Popular retirement destinations. Extraordinarily large population of elderly retirees in Florida. And so we all figured we'd start to hear some ridiculous numbers coming out of Florida. But Ron DeSantis doesn't want that to happen because, one, he was particularly slow in responding to the coronavirus pandemic, and so actual large reported numbers would make him look like an idiot and a murderer. And two, he's a big Trump fan, and it would, by extension, make Trump look like an idiot and accomplice to Ron DeSantis' murders. But anyway, I guess they decided that looking like emulating the Chinese Communist Party, as right-wingers would have it, seemed like a better route for DeSantis. And the report here from CNN, pardon me, and other sources seems to argue that there were explicit instructions from the governor's office to withhold accurate numbers about who was dying and in what numbers from coronavirus. Florida Medical Examiners Commission chairman says state officials asked them to withhold coronavirus death figures. Report Rosa Flores, Sarah Weisfeld, Devin Cole, and Paul LeBlanc of CNN. And it says it this way. The Florida Department of Health asked the Florida Medical Examiners Commission not to release the commission's comprehensive list of coronavirus deaths. The commission's chairman told CNN on Thursday. Dr. Stephen Nelson said that the commission was told by the Florida Department of Health, don't send it out. That sounds pretty straightforward. His comments come after the Tampa Bay Times said that the list from the medical examiners had previously been released in real time, but after the newspaper reported that the tally was 10% higher than the health department's tally, state officials directed that the list be reviewed and potentially redacted. The pause in reporting, the Times said, has been occurring for 9 days. And as we know, time is of the essence in figuring out what's happening in a pandemic. When asked if the difference in tallies indicates any wrongdoing by the Florida Department of Health, Nelson said no. Is Nelson from the Department of Health? I don't know. Let's see. Nelson is, I don't know, Dr. Stephen Nelson, I guess, is from the Florida Medical Examiners Commission, but obviously both state agencies, so he's not going to lay the blame at the other agency's feet, I guess. Our numbers will never jive with Florida Department of Health because they are counting different things than we are, Nelson said, and that's a plausible explanation. Nelson said on Thursday, the tally reported by the medical examiners was 20 deaths lower than the total reported by the Florida Department of Health. The Florida Department of Health told CNN in a statement that Florida's medical examiners make their own determinations on what level of information to provide, but that the department had concerns with the disclosure of personal information, something Nelson says he found odd because the information has been obtained by reporters, including CNN, from individual medical examiners. While the Florida Department of Health does not publish non-resident COVID-19 deaths, the department released the list upon CNN's request, which includes 43 cases. Nelson said the comprehensive list does not include the name of the deceased and only includes age, sex, date of death, cause of death, and a summary of what happened. So what's personal? I don't know. Just an excuse, I guess. He said the cause of death and the summary of what happened are what the department had an issue with. Without that information, he asserted the data is less informative. So I guess the state of Florida's assertion here is you are violating people's privacy by saying that there were people, not identified, but there were people of a certain age or gender who died of COVID-19. That's somehow a violation of somebody's privacy, and so something. Without that information, he asserted, of course, the data is less informative, less useful in general. The friction comes as Republican Governor Ron DeSantis contemplates how Florida will begin to reopen amid the pandemic. The governor on Monday noted the central role data related to the pandemic would play in the reopening efforts, saying the return to normal, if there is such a thing, would be methodical, slow, and data-driven. Except you got to have real data. At a White House meeting the following day, he said the first steps toward reopening would likely resemble the state's current status. That is to say, nothing will change. For Florida, going from where we are now to phase 1 is not a very big leap, DeSantis said. I think we will be able to be a small step. I think we will be able to be a small step for us. Not certain what that was supposed to be, but maybe it will be a small step for us. We will approach it in a very measured, thoughtful, and data-driven way. That's, of course, a great buzzword, but it doesn't work if you're manipulating the data. Florida currently has more than 33,000 coronavirus cases and more than 1,200 deaths from the virus, according to data from the Johns Hopkins University. CNN has reached out to DeSantis' office for comment. The Florida Department of Health told CNN on Wednesday that reporting deaths by residency is the appropriate method utilized to calculate disease rates, which allow for a more accurate analysis of disease impacts on populations through the incorporation of demographic data, a critical aspect of public health planning. That's a kind of a word salad, but I think that's what they're trying to say here is, if you die in Florida, this is interesting, given how people are arguing, well, you might die with COVID-19, but not of COVID-19. And similarly, you may die in Florida, but you might not be a Florida death if you are a New York resident who happens to die of COVID when you are in Florida. However, remember the way things are in Florida with all of their population of retirees. There are a lot of people. It's a big thing in at least among East Coast folks to split your time between, well, say New York or wherever you live and Florida. The President of the United States, allegedly, the alleged President of the United States, is a person who does that. He recently switched his residency to claim it was Florida, even though his claimed residence is apparently a beach club, which is not where normal people live, but I guess it's where he lives. But yeah, you see people split their time all the time. And a lot of them split it like really 6 months out of the year. They'll live in New York, and 6 months out of the year, and during the summer they live in New York, and during the winter they live in Florida. And if during the winter you are living in Florida, contract coronavirus, find yourself locked down, and die in March or April, unable to return to New York, or either because of the lockdown or because you're ill, should you be considered a Florida COVID-19 death? You lived there for several months, contracted it, and sought care there, and died there, but your driver's license says New York, so you don't count against Florida numbers. I'm sure they're thrilled to death anytime they can assign the death to another state. All right, well, let's continue on here. The statement from the department added that per CDC, people are listed according to their place of residence. This ensures cases are not inadvertently listed twice. That's a nice, that's an actual respectable goal, obviously. But in effect, the Florida Department of Health count does not include residents of other states who die in Florida. And that's not bad practice necessarily for other states. Florida, I think, has a slightly different situation on its hands and should recognize it. CNN corresponded with 2 medical examiner offices in Florida who confirmed that medical examiners report deaths within their geographic jurisdiction and not by place of residence. So that's what they're talking about, the health department and medical examiners counting different things. As a result, the state's county-by-county COVID-19 death toll and the county-by-county death toll reported by medical examiners will not reconcile. A spokesperson for the health department also told the Times that and we're here, Tampa Bay Times that we're talking about here, the department held conference calls with the Florida Department of Law Enforcement, which provides administrative support for the Medical Examiners Commission, about privacy concerns for those who passed away from coronavirus. The spokesperson said the health department did not provide a legal opinion, according to the newspaper. The spokesperson also pointed to a lag in reporting as a difference. The Times noted that the difference in figures has been a concern for Florida's Democratic congressional delegation, who sent a collective letter to DeSantis earlier this month asking for a detailed explanation of the public health justification for the difference in tracking methods. The lawmakers also asked the governor to work with the health department and the medical examiners to make sure coronavirus cases are identified and reported accurately, according to the Times. And a way to get a governor like DeSantis to admit how many people actually died in Florida, who really spend a considerable amount of time in Florida, and that's how they contracted it there and found themselves dying there as well. I suppose if another round of aid for stricken states and state health systems were in the offing, and it was distributed based on how many people actually suffered from coronavirus and were treated by healthcare providers in that state and eventually died there, then they would be willing to claim those deaths because they'd be worth money. All right. Well, of course, I suppose there would be other states saying, well, they've got an Ohio driver's license, so we get the money, even though they died in Florida. But obviously, I would think that the money should go to where the care was rendered. But what do I know? All right. That, too, an interesting aspect of what's going on around the country. Let's see. A couple of other things. For instance, noted over at MSNBC by Steve Bannon, who works with Rachel Maddow. I guess Trump was asked about economic plans going forward for the rest of the year and apparently dodged that question as well. Asked for his economic plan, Trump focuses on his feelings. But as we know from the T-shirt, F your feelings, right? Asked for his plan to help the economy, Trump focused on his feelings. The disconnect between the question and the answer is a problem. Steve Bannon reporting this one. As I mentioned a couple of years ago, Donald Trump boasted, I have a gut. It's not supposed to be a boast, and he does have a gut. But I have a gut, and my gut tells me sometimes more than anybody else's brain can ever tell me. The line was reminiscent of Stephen Colbert's old character from his Comedy Central show, except Colbert was kidding and the president's not. Nevertheless, Trump echoed the sentiment yesterday during an Oval Office event. A reporter reminded the president that Americans are experiencing economic conditions unseen since the Great Depression and asked, what is your plan to get the country out of this ditch? And he replied, I don't know, basically, but in these words. Well, I think we're going to have a great third quarter. That's going to be a transition. Well, so when I say great, I think the transition is going to be really terrific. Already, it's a word salad mess. I mean, based on what is it one question? Well, based on what do you think we're going to have a great third quarter? I don't know. Based on nothing. But in addition, well, what do you mean great third quarter? And how is that, what are you talking about? And how are we going to have a great third quarter when we've had such a terrible first and second quarter, beginning of the second quarter? Well, he says it's going to be a transition. Well, all right, it would be going from Great Depression to great, minus the depression. It is a transition, that's true. So when I say great, he says, I think the transition is going to be really terrific. Well, of course. What do you mean? When you say great, what do you mean? What kind of, how do you mean the transition is going to be great? Oh, well, when I say great, what I mean is terrific. Now, the question isn't, give me another word for great. The question is, how will it be great? By what measure could it be? What is it that you see that we don't, that makes you convinced that things will be great? And his only answer is, I say they'll be terrific. That's how I know it'll be great. Well, he continues on. It's going to be really terrific this third quarter, and we're going to take it into the fourth. And I think we're going to have potentially, he's going to come up with a new word for us, right? No, same old word, a great fourth quarter, potentially a great fourth quarter. There is tremendous pent-up demand. Now he's starting to get into something that approaches why he thinks the third and fourth quarters would be great. And his answer is, there's tremendous pent-up demand. Now, how do you know that there's pent-up demand? I feel it. I feel it. I think sometimes what I feel is better than what I think, unfortunately, or fortunately, So that's another great thing, all right? That's another great diversion there. Now, you could get away with saying there's, I think, tremendous pent-up demand. Why do I think so? Well, logic. Common sense tells you that demand has been awfully depressed of late, except for, things like hand sanitizer and toilet paper. There's been increased demand for those things. But there's lots of things that people ordinarily would have been spending their time and money on that they haven't been allowed to spend their time and money on, and they miss it. And as soon as they are able to spend their time and money on it safely, they will. And they will compensate for the losses of not being able to do the things they wanted to do for 2 months or more by doing lots of it when they are able to do it. That would be a decent explanation of the idea of there being pent-up demand, and that will boost the economy. As soon as we're able to go out there and do things and spend money the way they want to, the way people want to, they will. And they'll do it in great numbers. Okay, that would be a thing. But he can't express that. All he says is there's tremendous pent-up demand. I feel it. And, that's okay. There you can say, I have a feeling that people are going to want to do this. So I haven't polled them and asked them, are you going to go hog wild as soon as you are free from lockup? But I get the sense that people will, because that's the sort of thing you would expect of people. That would be an okay thing to say. Then I find this interesting too. He realizes, I might not know what the hell I'm talking about here. But there he says, sometimes I think what I feel is better than what I think, which is not a good thing to do if you're supposed to be leading the country. But whatever, I guess you could lead the country by gut, but hopefully we're thinking it's best if you're also a thinker. Sometimes I think what I feel is better than what I think, unfortunately, which he says with, I guess that's sort of supposed to be tongue-in-cheek self-disparagement, which is as close as he comes to, self-deprecating humor. But that's it's funny too. So that's unfortunate. Or it's fortunate. It could be also fortunate. So here's the forecast. It's going to be great. Why? Because I feel like it's going to be great. Why do I feel it's going to be great? Because I don't think that well. Which is either fortunate or unfortunate. You choose. Either way, we're covered. 100% sure that I've hit it right by saying it's either unfortunate or fortunate. We're either going to recover or we're not. We'll see. We'll see what happens. Right off the bat, Bannon continues, it's unsettling just how frequently Trump references his feelings about things that are detached from evidence of reason. As regular readers know, it wasn't long ago that the president rejected the World Health Organization's assessment of the pandemic fatality rates, telling Fox News, this is just my hunch. Soon after, Trump told reporters he had a feeling untested medications might be effective in combating COVID-19. A week later, the Republican added that he had another feeling that state officials were wrong about their need for ventilators in hospitals to treat infected patients. With a track record like this, the president probably ought to stop relying quite so much on his gut. What's more, the president's fact-free intuition is at odds with everyone and everything around him. As the Washington Post reported overnight, now with the economy in a free fall, less than 6 months before voters cast their ballots and daily life disrupted, Trump is trying a new tack, making bold new promises about a swift economic rebound that experts and even members of his own party say are unrealistic. But let's also not lose sight of the specific question the reporter asked the president to answer. What's your plan to get the country out of this ditch? And as his response made clear, Trump doesn't have a plan, he has feelings. The disconnect between the reporter's question and the president's answer served as a reminder that Trump won't be much use in the coming weeks and months when it comes to economic policy, and it'll be up to others to do the work. Good point. Worth keeping in mind. Probably already guessed it, but there it is. Let's see. Something else to keep in mind, just because the weekend is coming, and, we might as well call this one out and see if it goes anywhere. This is a germ of a news story. Germ's not the best term, really, to use for this, but I've done it. So, Justice Department, remember them? I don't know how much we can rely on them, but there's clearly two Justice Departments in operation here. The one over which William Barr exerts control, and then the rest of it. We don't know how long the rest of it can last. But the Justice Department, the rest of it, scrutinizes White House-connected doctor linked to disputed coronavirus treatment. Back to hydroxychloroquine, or whatever it was. Rosalind Helderman and Matt Zapotowski report this one. Federal prosecutors are examining the communications of a New York family doctor who appears frequently on Fox News and has been in touch with the White House to tout an anti-malarial as a treatment for the novel coronavirus, according to people contacted as part of the inquiry. This is, the examination is of Dr. Vladimir Zev, that's his nickname, Zev Zelenko. He's the guy who has been on Fox News a couple of times as being one of the original hype men for hydroxychloroquine. Well, this examination of Zelenko's records began when an associate, conservative commentator Jerome Corsi, who played a role in the Roger Stone trial, the Roger Stone controversy still ongoing as the appeals courts, or as the trial courts, consider a new trial for him, and appeals courts consider why that should be rejected, etc. Getting closer to a resolution in that case. Trump, of course, that means getting ready to pardon him once he loses all his appeals. But Corsi played a role in Stone world, and now he's found himself right back in trouble again somehow, or in the middle of things. So what's up with Corsi? Conservative commentator Jerome Corsi accidentally sent an email intended for Zelenko to another Z name in his address book. Unfortunately for Corsi, and I guess fortunately for the rest of us, the next Z in his address book was federal prosecutor Aaron Zelinsky, who was a member of special counsel Robert Mueller's team and had spent months scrutinizing Corsi's activities during the 2016 presidential election. During episodes of his daily podcast this week and in a YouTube video he posted late Thursday in response to questions from the Washington Post, Corsi said that Zelinsky responded to the unexpected email by reaching out to Corsi's lawyer and requesting all of Corsi's communications with Zelenko. Wouldn't that be amazing? And everyone was, by the way, don't lose track of the fact that Zev Zelenko's name was particularly interesting at the outset of all this because in addition to hyping hydroxychloroquine, it was noted for the record that Zelenko is, I guess, originally Ukrainian, which, only served to raise eyebrows once again. Corsi said he and Zelenko are collaborating on a website designed to connect people with doctors. I wonder if there is such a website already. They have acted lawfully, Corsi added, of course, but he plans to cooperate with the request and has handed over his communications. Zelinsky is tasked now with investigating coronavirus-related crimes in the Maryland U.S. Attorney's Office. So since his work with Mueller has ended, his new job has been coronavirus-related crimes. And, all right, so getting word from, suspected huckster Jerome Corsi that he's connecting up with Zev Zelenko for what might be just another of many coronavirus-related, if not hoaxes, misleading dead ends, perhaps. But all right, and it happens to land on the desk of the guy who's in charge of investigating that. It's going to cause problems. So anyway, let's see. By the way, by what authority is Zelinsky now working on investigating coronavirus-related crimes? Part of a directive from U.S. Attorney General William Barr, who asked that such cases be prioritized. The department already has charged a medley of fraudsters for peddling fake cures, selling personal protective equipment that they didn't actually have, or running more complicated Medicare reimbursement schemes, and officials say tips are coming in droves. Gregory Regano, a lawyer who said he's working with Zelenko, said in a brief telephone conversation Thursday night that they had not been contacted by federal prosecutors and that he was not aware of any possible law enforcement interest in Zelenko. Well, he goes on to give a quote to that effect. We'll skip it. In his YouTube video, Corsi displayed the email he inadvertently sent to Zelinsky. In it, he wrote that Zelenko had, quote, an FDA-approved randomized test of HCQ, hydroxychloroquine, underway. A reference to, HCQ being hydroxychloroquine, the anti-malarial. Despite the lack of scientific evidence, President Trump has enthusiastically promoted the drug as a potential treatment for patients infected with COVID-19, the respiratory illness caused by the coronavirus. Last week, the FDA, citing reports of serious heart rhythm problems associated with hydroxychloroquine, warned doctors against its use outside of a hospital or a clinical trial. But by Corsi's account, Zelensky went to a government website that lists his approved clinical trials and found no reference to Zelenko. Interesting. So why would you be claiming that he has a FDA-approved trial? I don't know. Hi, it's me, David Waldman, your host for Kagro in the Morning, and I've learned that I either need to update these announcements more often or stop saying that the announcements are brand new. What's not new is that this message, too, is a call for your support in keeping the Kagro in the Morning show on the air. My thanks go out to all of you who do support the show through your donations. The stats say that Kagro in the Morning fans download our program about 2,000 times each weekday. But our donors make up only about 8% of our daily listeners. Patreon.com, Patreon.com, makes it simple to make easy, secure, recurring monthly contributions to support our show. Patreon.com/KagroX gets you straight to our donation page. If we're helping keep you sane during the Trump era, consider what that's worth. $1 a day? 50 cents? One thin dime? We do about 20 shows a month, so pick a number, do the math, and head to patreon.com/KagroX to let us know. Thanks again, everyone, for all your support. Welcome back now to the Kagro in the Morning show here on Netroots Radio. I guess we can just finish this up. There are a couple of details I found, not surprising because of the people who are involved and they're kind of dumb and they don't really know what they're doing. But we left off with this story saying that by Corsi's account, Zelensky, the prosecutor, went to a government website that lists approved clinical trials and found no reference to Zelenko, which would make trouble for a guy like Zelenko, the doctor, saying that his trial, that his experiments with hydroxychloroquine are an FDA-approved clinical trial, which is a very specific thing that means something both medically and scientifically and legally, but he doesn't have that. And for Corsi to repeat that Zelenko says he does is possibly a problem for Corsi and almost certainly a problem for Zelenko. After learning of the federal prosecutor's interest, Corsi said, because he emailed him and said this was going on, Corsi said he asked Zelenko about whether he had an FDA-approved study, as Corsi said Zelenko had told another physician at a training event. Zelenko, Corsi said, then suggested his study was approved instead by an internal hospital panel. Well, I pointed out to Zelenko, but it's not registered as an FDA test, and you can't say it is, Corsi said Thursday on YouTube, adding that he did not feel Zelenko was trying to defraud anyone, but rather he just did not understand what it meant to have an FDA-approved test, which is kind of a bad thing for a doctor not to be able to understand. I did nothing wrong. Zelenko made a mistake. He's got no case, Zelensky, I guess, and we're following all the rules, Corsi said. He said he had turned over to Zelensky emails and text messages between himself and Zelenko, as well as copies of his podcast and marketing materials for the website. Everything he asked for. Corsi's attorney, David Gray, confirmed his version of the events. That's what you pay him for. It is unclear how seriously prosecutors are scrutinizing the matter. A Justice Department spokesman declined to comment, but even passing interest from federal authorities into efforts to promote the anti-malarial is likely to chafe the president and his allies, particularly given the involvement of a former member of Mueller's team. I'm very concerned about the government intrusion here on our freedoms, Corsi said on his podcast. I see the government demonizing a medicine, this hydroxychloroquine, that's been around for 70 years and is fully FDA approved for various illnesses. Trump spent weeks promoting the anti-malarial during his daily televised briefings, calling it at one point a game changer. It will be for Zelenko anyway, and maybe Corsi as well, that could help the nation quickly overcome the coronavirus. His comments echoed frequent segments on Fox News, that's where the problem arises, some of which featured interviews with Zelenko, who described how he had successfully treated hundreds of suspected COVID-19 patients with what he called a cocktail of hydroxychloroquine, the antibiotic azithromycin, and zinc sulfate. Experts, including Trump's leading infectious disease specialist Anthony Fauci, have repeatedly cautioned that while there is some anecdotal evidence the drug shows promise, its efficacy must be validated through controlled scientific studies. Zelenko consults frequently with some of Trump's closest allies. Trump aides say he has been in contact with Chief of Staff Mark Meadows and other officials. In a recent interview, Trump attorney Rudy Giuliani said he and Zelenko speak frequently, often more than once a day. He's a very smart doctor, Giuliani said, except he doesn't know the difference between FDA trials and anything else. But I've seen an analysis of Dr. Zelenko's patient list. There are thousands of people who have been helped by it. An analysis of Zelenko's patient list. Whatever, old man. Corsi said he was referred to Zelenko by another doctor also interested in COVID-19 and hosted Zelenko for the first time on his podcast earlier this month. Corsi's website, speakwithanmd.com, you're inviting trouble, offers people the opportunity to schedule a virtual appointment with a doctor by clicking on a button and inputting their name and address. In other words, give us your name and address and we'll have a doctor call you, and then a doctor will bill you. It's not really a great service. It advertises a low consult fee of $59.95, as well as prescriptions delivered right to your door same day through a partner. The site claims to be linked with more than 625 healthcare providers spanning all 50 states. In a FAQ section, it says it is, quote, designed to see and treat non-emergency type consultations, though it lists COVID-19 as one of the many health problems its doctors can examine, along with constipation, allergies, and the common cold. On his website, Corsi describes Zelenko as an unpaid medical advisor. Zelenko was a guest on Corsi's podcast Sunday and explained he is working with 2 German scientists and will soon be publishing data from his use of hydroxychloroquine with his patients. He accused Fauci and other government scientists of opposing use of the drug for political and financial reasons. History will prove me right, Zelenko said on Corsi's podcast. The difference between me and Dr. Fauci is only about 100,000 dead people. I don't even know what he's trying to say in that one. Corsi is best known for his promotion of the false theory that former President Barack Obama was not born in the United States, a topic over which he bonded with Trump before the celebrity mogul ran for president. Corsi was in close contact with Trump associate Roger Stone during the 2016 campaign, and the 2 men communicated frequently about WikiLeaks as the anti-secrecy group published Democratic Party emails that U.S. officials say were stolen and provided to the group by Russian intelligence. Corsi has said he was interviewed extensively about Stone by Zelensky and other Mueller prosecutors, who at one point drafted a plea agreement under which Corsi would have agreed that he had lied in an initial interview about WikiLeaks. Corsi ultimately refused to plead guilty and was not charged with a crime. Boy, he got away pretty well there. Stone was convicted of lying to Congress, obstruction of an official proceeding, and witness tampering, and sentenced to 3 years and 4 months in prison. He's appealing. Zelensky was notably among a group of career prosecutors who quit that case after Barr intervened to reduce the recommendation he and other prosecutors gave for Stone's penalty. So that brings us back to that story and reminds you of, where have I heard that name before? He quit that case and ended up getting, this is amazing, right? He quit the case, ended up getting assigned to investigating coronavirus-related fraud, and ends up right back in where he was, investigating Jerome Corsi and his connections with Donald Trump and Rudy Giuliani and others. These guys can't stop committing federal crimes. This is amazing. What are the odds that it would happen with the same investigator? Well, I don't know. But I guess they increased the odds by accidentally sending him evidence of a possible federal crime. But the guy must have been like, I can't believe I'm back with Jerome Corsi on this thing. I tried quitting this case and I can't get rid of Corsi. All right. A lot of other things to get to. Maybe we'll just start making some more recommendations for you to do some reading on your own during the weekend since we can't get to everything. One thing I want you to know about before the weekend, because, the weekend, I don't know what to make of this one. Once again, The Hill, probably grabbing this reporting from elsewhere, but still important enough to make a brief mention of. CDC recommends social distancing for pets. I know that's going to worry some of you. Social distancing for pets after some test positive for coronavirus. I think we were initially under the impression that humans weren't giving it to their companion animals, but I guess once you have animal to human transmission and then human to human, I guess eventually you're going to see some human back to the animals, I would guess. I don't know. Don't know enough about the dynamics of how that happens. I just want you to know to be careful with your pets. CDC is recommending people follow the same social distancing guidelines with their pets as they would human family members after a small number of animals, including dogs and cats, were reportedly infected with the virus that causes COVID-19. Now, I imagine they can't possibly mean exactly the same sort of social distancing as people practice. But, one, I don't know how that's possible inside of your home. I mean, it's difficult enough to stay away from, you don't, and you can't distance from other family members. And I understand when somebody is actively ill with COVID-19, you'll try and isolate them the best you can so that the rest of the family doesn't come down with it. It doesn't work very well in most cases, but you do your best. But you can't really isolate pets. And of course, pets are pretty much what people are depending on for any kind of even approximated faux social interaction. People can't keep their hands off their pets, and of course, the pets can't feed themselves, and you're going to have some contact. Anyway, the point is, I suppose, if nothing else, be careful, and I guess clean up the best you can, and watch your pets to see if they might require some medical attention. There's no word so far in all of this about what effects coronavirus infection is having on the pets. They're infected, but hopefully they're not suffering with it. CDC guidelines recommend people restrict their pets from interacting with other animals when outside their house. Okay, now we're talking. And urge people to keep cats indoors when possible and to walk dogs on a leash while maintaining at least 6 feet from other people and animals. Okay. So at least, some guidance about what you can and should be doing about this thing, and it's not putting your dog in another house or in a hotel while you stay at home or vice versa. But I guess it just means, as people, we heard originally that pets, dogs in particular, weren't getting infected, and so people were enjoying, I guess, vicarious social interaction by allowing their dogs to interact with one another at dog parks, and maybe it's just not a great idea after all. Poor dogs are going to be sad. If a person is sick with COVID-19, the CDC recommends avoiding contact with pets and other animals if possible. If a person must care for a pet while sick, the CDC recommends wearing a cloth face covering and washing hands before interacting with them. Okay, so treat them like a person. That's not the worst thing in the world. The CDC said most of the small numbers of animals reported to be COVID-19 positive were infected after having contact with a person with the virus, but the risk of having animals spread COVID-19 to people was considered to be low. So I guess if you find a lost dog that belonged to somebody who had COVID-19, how would you know? You wouldn't. But I guess there's a small risk that you could pick up their COVID-19 from their dog. Wash your hands anyway after handling somebody's dog. All right. Well, anyway, I just thought I would put that out there. The first case reported in the U.S. of an animal testing positive for the virus, by the way, a tiger at the Bronx Zoo in New York. And when Dr. whatever his name was said 43% of the Bronx has got coronavirus, he's not kidding. He includes the tigers in that. I don't think those were part of his figures, but we had heard about that story. All right. I just wanted you to have that for the weekend, whatever. If you're going to be spending time with your pets, be aware. Let's see. Other things that really probably ought to get some attention. I hope you read the rest of the article on your own about the guy who tweeted to the president that he could provide ventilators, got paid $69 million, and didn't cough up any, wrong word there again, cough up any of the ventilators. I didn't finish reading the article on the air, but it seemed like an important one. Another plunderer making millions, and I was interested in finding out how were they going about trying to get the money back and canceling it. But the article diverted into other very interesting information about other people cheating the government, and only eventually makes its way back to this guy. It was an interesting bit, but if we get a chance, maybe we'll double back and take a look at it. Other interesting stories, though, of states. More procurement stories and PPE and ventilator piracy going on under the Project Airbridge auspices. Stories from out of Colorado and Maryland, and I assume there are more out there. I really don't know why people are talking out loud about them, except I guess you got to illustrate the problem at some point. I guess the problem is more crystalline when you're talking about Maryland, because they, of course, have a Republican governor, though it is a governor, Larry Hogan, a governor with whom President Trump doesn't get along all that well, because Hogan keeps saying out loud that Trump is not a very good president and maybe doesn't know what he's doing. So here's the deal. I've got reports here from, The Hill. Let's see who they borrowed it from, if anyone, and we can go to the original source of the reporting, but also have something from Talking Points memo about the same story. They, too, I'm sure, borrowing from some other source, at least initially, but I think telling the story better than The Hill tells it. So let's go over to the Talking Points memo. Maryland Gov, as we say, shorthand for governor, using the National Guard to, get the pop-up out of the way. I would like to use the National Guard to get pop-ups out of the way if I can. National Guard, Maryland using National Guard to keep feds from seizing COVID-19 tests that he's gotten for himself. And I think Colorado got them very much the same way, direct from South Korea. Remember when they were the gold standard? And remember why they were the gold standard? Not just because once declared the gold standard, they always remain the gold standard. But that was the case. They had good tests. We couldn't get any. So the governor of Maryland and the governor of Colorado said, let's fly a damn plane. Let's do our own air bridge. This is what the legit side of air bridge, the air bridge project was, well, if the products exist and they're in Asia and we're here in the Americas, why don't we find a plane and fly there and get the stuff? That was the good side of air bridge and the air part of air bridge, except then they stole the stuff and you couldn't get it. And Trump was going to use it for blackmail. Another important part of the story. But in Maryland and in Colorado, they said, we have planes. We know where Asia is. Let's go get the stuff ourselves. Josh Kovensky, writing here for TPM, says, Maryland Governor Larry Hogan is hiding something somewhere. In a video interview with the Washington Post, they're the ones behind the original reporting, Hogan said that he had enlisted the National Guard and state police to protect 500,000 COVID-19 tests that he had procured from South Korea from potential seizure by the feds. The National Guard and the state police are both guarding these tests at an undisclosed location, Hogan said. So you got guns drawn, states against the feds, if necessary, to protect these things he's procured. Hogan said the decision to hide the precious tests was motivated in part by reports that the federal government had been confiscating shipments sent to other states, like Massachusetts. There's been reports of, for example, in Massachusetts, Governor Charlie Baker, another Republican, who told the story that his plane load coming in getting confiscated by the federal government, the Maryland governor said. Hogan's remarks come amid reports from around the country over the past month that federal authorities have seized personal protective equipment, or PPE, as it enters the country. TPM profiled one case in which the importer was able to convince the feds not to act on a Defense Production Act order the government had received in order to take possession of a shipment of masks. Hogan has said he managed to secure the 500,000 tests thanks to help from his wife, which ordinarily we say, roll our eyes and say, oh no, the wife is suggesting things again and might not know what she's doing, not because she's a she, but because she's not the elected official. She's just, the spouse of the elected official. Certainly the reverse could happen, although we don't hear a whole lot about that, about women governors saying, my husband suggested something. But that's probably not because it's not happening necessarily, but because probably women politicians are more sensitive to what it looks like to say my spouse said XYZ and I did it. But because they're women, they wouldn't be able to get away with it. They'd all say, oh, the real governor is the husband. Whereas with a man governor, it's something I guess they feel like they can get away with and say they were listening to their wives and not have everybody say, well, why isn't she the governor then? But okay. Anyway, she's Korean, his wife, originally. So American now, obviously, but I guess originally Korean, and was able to help navigate the maze here. And she was purportedly able to call the South Korean ambassador to the U.S. for help. The Maryland governor said that the state arranged for a Korean airplane to land at Baltimore Washington International Airport to prevent the shipment from having to cross state lines. Very clever, good thinking. Don't want it crossing state lines and giving the feds jurisdiction over the stuff. Although I wondered, BWI, it's an international airport. Does Korean Air not fly there? Is that why they had to arrange for it to land at BWI as opposed to, say, Dulles Airport and pick it up there so it wouldn't cross state lines? I don't know. Anyway, we landed it there with a large contingent of Maryland National Guard and Maryland State Police, Hogan said. It was like Fort Knox to us, which is, of course, currently being ripped off of its gold bars by Steve Mnuchin. Hogan, a Republican governor in charge of an otherwise blue state, has found himself among the governors locked in public feuds with President Trump over the White House's mismanagement of the pandemic. We guarded that cargo from whoever might interfere with us getting that to folks who need it, Hogan said. And, of course, that also highlights the story of Trump disclaiming any responsibility for testing and saying it's the state's responsibility to get and provide tests for its people. And then when they go and get them, those states are in danger of having them seized by the federal government, which is an amazing thing to do. If the federal government says it's the state's responsibility to get those tests and then the states go and get those tests, by what authority would the federal government be seizing them? And the answer we hinted at last week was that they would not have any such authority. They would only have, they would ordinarily be able to claim such authority and have courts recognize it, because it's usually assumed that in a situation like this, where several states would be otherwise competing with and interfering with, possibly accidentally, possibly on purpose, interfering with each other, getting the tests that they want and competing for the same tests on the open market, that's where you have the federal government step in and say, we'll have one buyer and we'll settle that issue and we'll distribute the tests as necessary. That's such a logical and laudable goal that courts ordinarily will defer to it in the first instance and say the federal authority to seize these things rests upon the knowledge that the federal government is fixing a procurement problem and solving it in an efficient way. That's why we recognize their right to step in and seize these things. But if the federal government is seizing them and then instead distributing them as political favors and preventing states that procured them from actually enjoying the use of them, well, that logical basis for interference disappears, and a sane federal court would say, well, although we usually presume federal primacy in situations like this, that's because we've always had governments where it made sense to assume that federal primacy would lead to something like, anyway, an attempt at a logical and orderly distribution of these things. But since it's not happening, there's no reason to jump out of the way of the federal government when they seize these things, and we can examine the reasons for reasons by which they claim this authority and what they're doing with them, to see if they're arbitrary and capricious and therefore without basis. But anyway, I don't know. That apparently upset some of the conservative commentators who still think that that's a bad legal take. Although I did notice that the guy who referred it to bad legal takes on Twitter had no takers there. The people who run the bad legal takes Twitter feed got his suggestion and said, either said not interesting enough or simply just said, not actually a bad legal take. So we're going to pass on that one. Anyway, similar story as I mentioned for Colorado. I have here a tweet from Ryan Warner. Who is Ryan Warner? I don't know. Let's see. My job is questions and answers and follow-ups. Senior host of Colorado Matters and CPR, I guess Colorado Public Radio News. So I imagine our Colorado friends are familiar with Ryan, or at least with CPR. Anyway, Colorado also bought 100,000 coronavirus tests from South Korea using emergency funds. They're here now, and Governor Polis of Colorado says he's kept it under wraps so that they weren't confiscated by the feds or others. I don't have any write-up on that one, but at least a good tip. Maybe by now he has actually written something somewhere, Ryan Warner or someone else from his outlets. But I just wanted to note for the record that that's happening in Colorado, not just in Maryland. And then maybe one other story, I guess, for the weekend in terms of what to anticipate for things to come. Well, let's see. One, some additional work and some more progress in the House with the idea of perhaps adopting or readopting a proxy voting scheme that would allow some functioning of the House of Representatives, even if they don't come back into session next week. And two, given what we read about what the initial wave of infection means in New York and what at least one doctor thinks might mean for reopening New York, if not the entirety of the country, we have another cautionary tale as a counter. Small example here, Mason County in-person city council meeting, that's Mason County, Texas, results in COVID-19 case spike. That's not so good, right? KXAN, an NBC affiliate in Texas, reports this one. Caitlin Carmout, the reporter here on this one. Dateline again, Mason, Texas. We haven't heard of many positive COVID-19 cases coming out of rural Texas counties until now. 18 people. That's not a whole lot in the grand scheme of things, but for down there, I guess it is. 18 people have tested positive for the coronavirus in Mason County, with more results pending. Mason County Judge Jerry Bearden confirmed Thursday that the spike in cases is due in part to a recent in-person city council meeting. We were just riding along in the local wagon, and all of a sudden the wheels fell off, said Mason County Judge Jerry Bearden, who we've already had introduced, so it's a little bit duplicative. But all right, editors, get on that. We now have an open-wide pandemic here in the county. Mason County is 115 miles just northwest of Austin, with a population of 4,200 people. Who would ever have expected that in Little Mason we would have gone from 1 case to 17, said Judge Bearden. I'm assuming by the time I get more information, we'll get up to 10, which is actually lower than 17, and I don't know what the hell he's talking about. Maybe it's a typo and they meant 20. I have no idea. Not a very well-edited article, I'll say that. 2 weeks ago, the town of Mason was still holding in-person council meetings. Their meetings, T-H-E-R-E meetings, were being held inside a room with people 6 feet apart, but the virus still managed to seep through the seams. It started with elected officials and clerks, said Judge Bearden. They had a city council meeting that afternoon, and things went from there. I thought that was a rather interesting way of putting it, right? Who would have thought that we would have gone from 1 case to 17 just simply by doing exactly the wrong thing that all the health experts told us would lead us from 1 case to 17? Well, I don't know. For some reason, they didn't buy into the logic until it was too late. Judge Bearden says for the most part the county has been practicing Governor Abbott's executive measures by shutting down businesses and county offices to the public, but still allowing staff to work inside. So that's not doing it. Now we're closing down facilities. The city of Mason closed their offices down for a week, said Judge Bearden. That's not enough. There isn't a hospital here in Mason, just a small clinic with a physician and a few nurses. Since the outbreak, they've rapidly been testing people. Judge Bearden says the county hasn't had the resources to mitigate this virus, but more testing capacity is to come on Monday. The National Guard is sending out for testing for folks in rural areas. The National Guard will be in the town's community center on Monday to test many more. As of Thursday afternoon, 143 people were tested inside the county with nearly 100 results pending. 24 have come back negative, which I guess means 10 were positive. So what's the 17 all about? I don't know. You'll have to go down and find out, but if you do, wear a mask. In the meantime, we'll ask Justice Putnam to tell us what's going on around the world and across the country in corners other than Mason, Texas. And he's got lots on the menu for you. The Louisiana GOP, this is a great story, trying to repeal the state's emergency declaration, but will lose federal funding to fight the virus and help small businesses. That's bad news. They also, as I understand it, spent the other day voting by mail to repeal other Louisianans' right
Daily
to vote by
Radio
mail.
On networksradio.com. You have been listening to the Kagro in the Morning Show.
With David Waldman.
Ah, yes, another part of the air bridge conspiracy going to be examined as well. Appeals courts ruled against Trump's attempt to withhold funds from sanctuary cities, and now, I guess, the newest angle on that, he's saying that we will only be offering up assistance to states dealing with COVID-19 if they give concessions on those sanctuary cities. We'll see you next week.